All right, so you talked about the modalities of different therapy models. However, what treatment options are available for anxiety?
Yeah, so there's a number of different treatment options for anxiety, depending on what you're trying to accomplish. And generally, they're not mutually exclusive of each other. And so they can work together and actually get you better results. So probably the first place, or the foundational thing that we as therapists always start with are what's called the lifestyle medicine approaches. And so lifestyle medicine is just taking care of our body in such a way that it's able to metabolize stress hormones like adrenaline and cortisol, which are released in our body by anxiety. And so when we have a sympathetic activation nervous system, that's what we call anxiety. It's a result of these stress hormones being released into our nervous system because of something that is triggering that. And so by engaging in regular exercise, so one study showed like vigorous exercise 3 times a week can reduce anxiety symptoms by as much as 50%. So getting regular exercise, diet can mediate anxiety symptoms to the tune of 10 to 15% reduction. Adequate sleep hygiene can reduce symptoms as much as 30%. And so just by engaging good lifestyle medicine, good health practices with diet, exercise, sleep, you can mediate the symptoms of anxiety 50 to 60%, which is incredible because it is on par with any medication or symptom management therapy that we have. So doing those things, super helpful. But then you can also later on top of that, a therapy that is aimed at addressing not only managing the symptoms, but actually addressing the root cause of your anxiety. Like all anxiety tells a story. It is happening for a reason. Sometimes it feels like anxiety comes out of nowhere and has no cause that you can identify. But just because you can't identify the cause doesn't mean there isn't a cause. Anxiety always has a cause, and it's rooted in our story where our nervous system has learned to sound the alarm for some reason, and it's sounding that alarm now, and that's why we're experiencing anxiety. So if we'll get curious about what in our story is telling our nervous system that it should sound the alarm in this moment, we can actually find resolve to those things in a way that causes our nervous system to stop sounding the alarm so we don't just have to manage the symptoms. Other things aimed at managing the symptoms, of course, are medication. You have a variety of different classes of medication that come at the task of managing symptoms, regulating the brain from different angles and approaches, but they're all symptom aimed and managing symptoms is their goal and outcome of it. So therapy, medication, a lifestyle medicine, these are the primary ways that we come at treating anxiety. Thanks for hanging out with me, watching this video. If you've got questions, leave them in the comments. We'll make some more videos. And until next time, I want you to know that I'm praying for you and that I'm cheering you on as you mature into true happiness.